After studying this module, you shall be able to know the terms related to personality-like traits, types and states, understand how personality assessment is done, understand the different methods of personality assessment like objective, projective and behavioral assessment methods, know what the Rorschach ink blot test is and how it is administered. Understand the various behavioral assessment methods. Introduction. Clinical psychology is that branch of psychology that has its primary focus on the prevention, diagnosis and treatment of abnormal behavior. Clinical help is the identity of psychological help because in the absence of it, psychological help will be reduced just to a common sense social help. Clinical assessment has a long history in the field of mental health. Clinical psychologists receive training in psychological assessment and in psychotherapy and are employed in hospitals, public and private mental health centers, independent practice and academia. In this module, we will understand the use of clinical assessment, the tests used for clinical assessment and focus on tests like Psychiatric Evaluation Form, Thorndike dimensions of temperament and Goodenough-Harris draw a person test to name a few.
The use of psychological tests in clinical setting is guided by three models of mental health: the information gathering model, the therapeutic model, and the differential treatment model. Information gathering model is used to collect information for the diagnosis of the mental health problems. The psychological tests in the therapeutic model provide new experiences and information to the client for self-discovery, personal growth, and development. The differential treatment represents the use of tests for conducting research and evaluating the outcomes of the intervention programs. Therefore, there are three ordered stages of clinical intervention: beginning, treatment, and termination and follow-up. In the beginning phase, tests are used for diagnostic purposes and they may chiefly include clinical interviews and projective tests. In the treatment phase, the levels of abnormality are measured with the use of various psychological tests and electrophysiological techniques. Psychological tests are used even after the formal termination of the treatment as a precautionary or follow-up measure. Psychiatric Evaluation Form is a new rating scale designed to record scaled judgments of a subject's functioning during a 1-week period. It covers dimensions of psychopathology of traditional interest, as well as alcoholism, drug addiction, sociopathic behavior, impairment in daily routine and leisure time, and the roles of housekeeper, wage earner, student, mate, and parent. An optional interview guide is provided and may be used as an aid to assure coverage of the areas on which judgments are required. In addition to 19 scales that tap specific dimensions of psychopathology and functioning, there is a summary scoring system based upon a factor analysis of data from a large sample of newly admitted inpatients. A summary role impairment score can also be obtained by using data from the 5 individual role impairment scales. The PEF scales, both individual and summary, have been shown to have high interjudge reliability when the judgments are made by trained raters. The scale scores discriminate between diagnostic groups and other groups expected to differ on various dimensions and reflect changes in levels and kinds of psychopathology when used repeatedly with the same subjects. Individuals from a variety of disciplines and with various levels of education and clinical experience have been trained to use the PEF with a degree of reliability and validity satisfactory for research purposes. Teaching tapes, a training manual, and suggested procedures for training interviewers are available. The provision of an interview schedule and the inclusion of dimensions of functioning not generally included in most currently available rating scales has made the PEF valuable in a wide variety of research endeavors. Thorndike dimensions of temperament. The test provides scores on 10 temperament dimensions or traits. The traits' names are sociable, ascendant, cheerful, placid, accepting, thought minded, reflective, impulsive, active, and responsible. The test is applicable to grades ranging between 11 to 16 as well as for adults. There are 200 items. The examinee is presented with a set of 10 statements of approximately equal endorsement popularity, with each statement representative of a different trait. There are 20 such sets of statements. The forced choice structure of the TDOT stems from the fact that research has pointed to the importance of a social desirability factor, that is, individual differences in the tendency to respond in a self regarding versus self critical manner, as a determiner of response to personality inventory items. This factor produces correlations between items from differential scales, which obscures the differential measurement of the traits the scales are designed to measure. While the forced choice format cannot prevent subjects from presenting a more favorable image of themselves if they choose to do so, this problem is normally less in the forced choice than in the questionnaire format. In each set, the examinee chooses the 3 statements which they think are the most like them and 3 which they consider are least like them. Each trait is represented by a statement which may be worded towards one or the other trait. Scoring. A positive and negative pole for each trait has been designated. The trait score is the difference in the sum of the ratings for the positively and negatively worded items. Since each set of items contains both positively and negatively worded statements, the 20 scores for each examinee do not have to add up to the same total. An examinee can have generally high scores by choosing the positively worded statements as most like him and the negatively worded statements as least like him, or generally low scores by having just the opposite response pattern. This feature of the TDOT reduces an undesirable effect of forced choice methodology in that it avoids the necessarily negative average correlation between scales that characterize the usual forced choice format. The reliability of the test ranges between 0.54 to 0.87 and the validity of the test is 0.10. The structural limitations of the TDOT, its marginal reliability, and its lack of adequate validity data provide no justification for its use in real life situations. The inventory's use in research, though hampered by many of these same problems, may conceivably uncover Fruitful applications for this instrument. Goodenough-Harris Draw a Person test. This test was developed originally by Florence Goodenough in 1926 and was later revised by Dr. Dale B. Harris in 1963, who extended the test and is now known as the Goodenough-Harris drawing test. It is a projective personality or cognitive test used to evaluate children and adolescents. Test administration involves children to complete 3 drawings of a man, woman, and themselves, head to feet and not just the face. The drawings reflect the anxieties, impulses, self-esteem, and personality of the test taker. The test administrator uses quantitative scoring system which analyzes 14 different aspects of the drawing such as specific body parts and clothing for various criteria including presence or absence, detail, and proportion. In all, there are 64 scoring items for each drawing. A separate standard score is recorded for each drawing and then a total score for all the 3 drawings. To assess the test taker for emotional problems, the administrator can use SPED, screening procedure for emotional disturbance. This system is composed of 2 types of criteria. For the first type, 8 dimensions of each drawing are evaluated against norms for the child's age group. For the second type, 47 different items are considered for each drawing. Since DAP does not require language or verbal skills to complete the task, it has wider applicability. However, test results can be influenced by previous drawing experience. There has been much debate over the overall reliability and validity of figure drawing tests. For example, when structured scoring systems are used, the DAP has been found to be a reliable measure, especially for cognitive development in children. However, with regard to specific personality characteristics, self-image issues, or personality dysfunctions, there has been relatively little support for the use of figure drawings. State Trait Anxiety Inventory. The State Trait Anxiety Inventory was initially conceptualized as a research instrument for the study of anxiety in adults. It is a self-report assessment device which includes separate measures of state and trait anxiety. According to the author, state anxiety reflects a transitory emotional state or condition of the human organism that is characterized by subjective, consciously perceived feelings of tension and apprehension and heightened autonomic nervous system activity. State anxiety may fluctuate over time and can vary in intensity. In contrast, trait anxiety denotes relatively stable individual differences in anxiety proneness and refers to a general tendency to respond with anxiety to perceived threats in the environment. The test is used for studying anxiety in research and clinical settings. Scores on the STAI have a direct interpretation. High scores on their respective scales mean more trait or state anxiety, and low scores mean less. Both percentile ranks and standard scores are available for male and female working adults in 3 age groups: male and female high school and college students, male military recruits, male neuropsychiatric patients, male medical patients, and male prison inmates. The stability of the STAI scales was assessed on male and female samples of high school and college students for test-retest intervals ranging from 1 hour to 104 days. The magnitude of the reliability coefficients decreased as a function of interval length. For the trait anxiety scale, the coefficients ranged from 0.65 to 0.86, whereas the range for the state anxiety scale was 0.16 to 0.62. This low level of stability for the state anxiety scale is expected since responses to the items on this scale are thought to reflect the influence of whatever transient situational factors exist at the time of testing. The correlation between state and trait scales is between 0.51 and 0.67 for male undergraduates and 0.44 and 0.55 for female undergraduates. Correlations are presented in the manual between this scale and other measures of trait anxiety, the Taylor Manifest Anxiety Scale, the IPAT Anxiety Scale, and the Multiple Affect Adjective Checklist. These correlations are 0.80, 0.75, and 0.52 respectively. Rotter's incomplete sentences blank. The Rotter's incomplete sentences blank comes in three forms for different age groups and comprises 40 incomplete sentences, usually only 1-2 words long, such as I regret. The subject is asked to complete the sentence. Its aim was to provide a technique which could be used objectively for screening and experimental purposes, as well as to obtain information of rather specific diagnostic value for treatment purposes. The Rotter sentence completion stems are similar to the sentence stems shown below. If only I could feel more hopeful about things. People I know are usually fair and honest. The Rotter's incomplete sentences blank is an attempt to standardize the sentence completion method for the use at college level. These completions are then scored by comparing them against typical items in empirically derived scoring manuals for men and women and by assigning to each response a scale value from 0 to 6. The total score is an index of maladjustment. The advantages of this test include freedom of response, that is, the subject is not forced to answer yes or no or to the examiner question. Some disguise in the purpose of the test is present. That is, although the subject may be aware of general intent, what constitutes a good or bad answer is not readily apparent to most subjects. Group administration is also relatively efficient, and most incomplete sentences tests can be given to a group of any size without apparent loss of validity. The interpretation depends on the examiner's general clinical experience, although the examiner does not need specific training in the use of this method. The method is extremely flexible in that new sentence beginnings can be constructed or tailor-made for a variety of clinical, applied, and experimental purposes. Death Anxiety Scale. Applicability: 12-year-old. Measures death anxiety that permeates a variety of life experiences. Number of items: 15. Reliability and validity. The scale was found to have satisfactory reliability, which is free of response sets. The Institute of Personality and Ability Testing Anxiety Scale Questionnaire. Applicability: 14 years and over. Measures free anxiety. Number of items: 2 20-item subscales, covert and overt anxiety, classified into 5 primary trait factor scales consisting of 2 or 6 items each. Reliability 0.77 to 0.86. Validity correlations with Taylor's anxiety scale 0.70, with Maudsley and Eysenck neuroticism scale 0.73, construct validity. State trait anxiety inventory for children. Applicability grades 4 to 6. Measures a state, how you feel right now. Number of items 40 items, 3-point scale. Reliability internal consistency coefficients for A state are 0.82 for males and 0.87 for females. Coefficients for A trait are 0.78 and 0.81 respectively. Test-retest reliability coefficients for A trait are 0.65 for males and 0.71 for females. Coefficients for A state are 0.31 and 0.47 respectively. Validity correlations between the A trait scale and both the Children Manifest Anxiety Scale and Generalized Anxiety Scale for children are 0.75 and 0.63 respectively. Ego State Inventory. Applicability adolescents and adults. Measures 5 ego states: punitive parent, nurturing parent, adult, rebellious child, and adaptive child. Number of items 52 items, each consisting of a cartoon drawing of 2 or more people in social situations. Reliability test-retest reliability ranges from 0.47 to 0.73 on the 5 scales. Validity correlations of various of the ESI scales with other tests such as Rock-Eates Dogmatism Scale and scale from Gore's California Personality Inventory Cluster around 0.06. Eysenck Personality Inventory. Applicability grades 9 to 16 and adults. Measures E, that is extroversion introversion, N, that is neuroticism stability, and Lie scale, developed and adapted from the Minnesota Multiphasic Personality Inventory with some modifications. Number of items 24 item E scale, yes, no inventory, 2 parallel forms, 24 item N scale and 9 item Lyle scale. Reliability test-retest reliabilities range between 0.80 and 0.97 and correlations between the two forms run from 0.75 to 0.91. Validity construct and concurrent validity vary in quality and completeness.
Summary. The use of psychological tests in clinical setting is guided by the information gathering model, the therapeutic model, and the differential treatment method. The psychiatric evaluation form is a rating scale that covers dimensions of alcoholism, drug addiction, sociopathic behavior, impairment in daily routine and leisure time, and the roles of housekeeper, wage earner, student, mate, and parent. The Thorndike dimensions of temperament provide scores on 10 temperament dimensions or traits, namely sociable, ascendant, cheerful, placid, accepting, thought-minded, reflective, impulsive, active, and responsible. The Goodenough-Harris Raw Person test is a projective personality or cognitive test used to evaluate children and adolescents that reflects the anxieties, impulses, self-esteem and personality of the test taker. The State Trait Anxiety Inventory is a self-report assessment device that includes separate measures of state and trait anxiety, where state anxiety reflects how one generally feels and trait anxiety refers to how one feels at the moment.